Okay, then we're going to switch gears to our 5-minute rapid presentations. And our very first presenter is Dr. Barnett from York University School of Nursing in Toronto.
Hi, everyone. I am not a doctor. I am a nurse, and I do not have a PhD. But I'm really happy to present today. I'm presenting our scoping review on cis and transgender women's experience with HIV prevention, specifically pre-exposure prophylaxis and post-exposure prophylaxis. These are my disclosures. So, the background for this is cis and trans women account for over 50% of people living with HIV globally. And we know that there's challenges for access for women. And then we have a low PrEP to need ratio among women. And so this review, is obviously a rapidly expanding field, but this review, we're really trying to identify key facilitators, barriers, and opportunities for improvement. So we had 4 databases that we searched up until May 2025. So this is a very recent review. We found over 12,000 articles, and we had a big team reviewing these articles down. You can see the inclusion and exclusion criteria. And so we got to abstracts in full text, and a total of 380 articles were included at the final mark there. We saw a lot of interesting things in the data, and so because this is a rapid fire, I'm going to share what I found most interesting and what our patient partners found most interesting. So across North America, Europe, and Asia, and Latin America, women definitely feel underrepresented in the PrEP advertising. Most of the advertising in these countries is by gay and bisexual men who have sex with men. Daily PrEP adherence is a common challenge, particularly in the context of unmet social determinants of health, intimate partner violence, and stigma. Relationships play a big role, as long with global mistrust of pharmaceutical companies. For trans women, uncertainty around PrEP and hormone interactions is a concern. I definitely see this in my own clinical practice. Facilitators include discrete options, injectables, unmarked packaging, along with offering HIV prevention in trusted care settings. For example, adolescent girls and young women in Kenya, Tanzania, Zimbabwe, South Africa prefer access points that are mobile vans, needle and syringe programs for women who inject drugs, and how we just heard, women who do sex work would like to access PrEP on outreach along with peers. And for pregnant women, it's maternity care centers. Trans women want to access PrEP where they access their gender-affirming cares. Motivations include empowerment, condomless sex, and family paneling. So in conclusion, it's clear women want discrete, accessible options for HIV prevention, but awareness and barriers persist. In terms of this review, PrEP is largely inaccessible to women globally. We did find articles that were included in those 12,000 on PrEP in pocket, and those were screened out because they were only on men. And so I think that there is a gap here where we could be doing some more research on PrEP in pocket for women. I would like to thank INSU for inviting me to speak today, our patient partners who reviewed the slides and helped us with the data, as well as our advisory committee and the whole research team. Thanks very much.
Thank you. We have time for a question, if you have one.